Cleft lip, embryology. The face develops from 5 processes. The frontonasal process in the midline above, followed by 2 maxillary processes right and left, followed by 2 mandibular processes right and left. Facial embryological components. The frontonasal process, the maxillary process, and the mandibular process. Cleft lip embryogenesis. Failure of fusion of the frontonasal with the maxillary process. Classification. According to the affected side, it might be unilateral or bilateral. According to the extension, it might be incomplete or complete. According to the association, it might be isolated or combined with cleft palate. Unilateral and bilateral cleft lips. Incomplete and complete. Incomplete, there is separation of the oral and nasal cavities, but in the complete one, there is no separation of the oral and nasal cavities. The 2 cavities are open with each other. Isolated cleft lip, affection of the cleft lip only, bilateral and unilateral. Combined cleft lip and cleft palate, unilateral or bilateral. Problems. Psychic problems, feeding problems, cosmetic problems, teething problems, and speech problems. Psychic problems early for the parents and relatives, later on for the patients. Family psychiatric problem. Treatment of family psychiatric problem by psychological assurance. Feeding problem. Failure of labial competence around the nipple. Failure of induction of negative intraoral pressure. Failure of suckling. Failure of breastfeeding, and failure of normal growth. Treatment of the feeding problem is breast milk collection using a manual expression or manual pumps or electric pumps. Breast milk feeding using spoon, syringe, dropper, or special teat and bottle. Cosmetic problems evident. Columnar overgrowth. The normal columnar size, the overgrown columella. Columnar overgrowth, absence of the middle of the upper lip leads to columnar overgrowth. The early corrected cleft lip acts as a barrier against columnar overgrowth. Treatment of the cosmetic problem, in general, early surgical correction avoids cosmetic complications. Teething problems, teeth overcrowding, twisting, and maldirection. Treatment of teething problems, early surgical correction diminishes teeth overcrowding, twisting, and maldirection. Residual teething problems are corrected by orthodontic procedures. The orthodontic procedures before and after correction. Speech problems, defective pronunciation of English letters needing competence of the lip, like letters B, F, M, and P, and in Arabic language the letters B, F, Mim. Treatment of speech problems, early surgical correction avoids the speech problems, prophylactic. Residual speech problems are corrected by speech therapy. Surgical treatment for the unilateral or bilateral. The idea of the operation is paring down of the edges, suturing skin to skin, muscle to muscle, and mucosa to mucosa. Operative details are not needed for undergraduate students. Surgical timing. Surgery at the age of 3 to 6 months of age to avoid most of the problems. Advantages of early treatment. Early assurance of the parents and relatives, early correction of the feeding problem, prevention of columnar overgrowth, helps spontaneous correction of the alveolar clefts, helps correction of the teething problems, correction before the age of speech to avoid the speech problems. Good luck and best wishes.